Hi, everyone. We're going to go ahead and get started. We've got a lot of material to cover today, so we're just going to jump right into it. Thank you for joining us today. This is our first webinar from the Survivors Leadership Council and from Sovereign Bodies Institute. So we're really thankful that all of you are joining us, and a big first for us. And today we're going to be talking about sex trafficking, survival sex work, and missing and murdered Indigenous women, girls, and Two-Spirit people in the time of COVID-19. So we're going to start by acknowledging that the last couple of days have been some significant days for 3 families of murdered Indigenous women. So today is Khadijah Britton's birthday. Khadijah Britton is a Hoopa Valley tribal member and a Round Valley tribal member, and she has been missing for quite some time and is a victim of domestic violence. And is missing from Covelo, California. We also want to acknowledge that earlier, a few days ago, was Rosenda Strong's birthday. Rosenda Strong was from Yakima Nation, and one of her relatives is one of the speakers today. And her birthday was also a few days ago. She went missing and was later found murdered. And then a few days ago was also Kelly Goforth's birthday. Kelly Goforth was found murdered in Regina in 2013. And the reason we want to open up the space by honoring these 3 ladies is that for the families and for the advocates that work with them, it's not just that the incident happens once and then goes away. There's all sorts of reminders and memories that constantly come up and never really go away. And for these 3 families, that's been the last couple of days with these 3 ladies' birthdays. So we wanted to acknowledge them here. I'm going to start by talking a little bit about the Survivors Leadership Council and give all the speakers a chance to introduce themselves. My name is Anita Lucchese. I am Executive Director of Sovereign Bodies Institute. We are a nonprofit research center focused on gender and sexual violence against Indigenous peoples, and we are a proud affiliate of 7th Generation Fund for Indigenous Peoples. We started the Survivors Leadership Council as a way to create a safe space and a means for amplifying survivor leader expertise. The council includes Indigenous survivors of trafficking and survival sex work from Indigenous peoples across North America. So the idea behind this was that as survivors, we have critical expertise and experience that can make a big difference in how we design new programs or new services for survivors of trafficking and survival sex work, but also that we're constantly kind of spoken over and spoken for, especially as Indigenous survivors. So it was really important for us to create a platform to speak for ourselves and to support survivor leadership. And in our first meeting, we decided that the mission for the council was going to be to advocate for victims and survivors, to provide peer support to movement leaders who are survivors, and to create a platform for survivor voices. Our office is located on Wiyot territory in Northern California, and that's where I'm joining you from today. And now I'm going to turn it over to our other speakers to introduce themselves.
My name is Jessica Smith, and I am Ojibwe from the Boys Fort Band of the Minnesota Chippewa tribe. I reside near the Fond du Lac Reservation and Lake Superior, and I'm a student at University of Wisconsin-Superior.
I'm Carrie Herthel. I'm Estlin Rumson Ohlone, and I live on my ancestral land here in Monterey County, California.
Hello. Chuck Patchway, Inknash Winooksha, Roxanne White, Washnash Kinnick, Yakima Kinnick, Nimipu, Kanik, Nooksack, Kanik, Ananin, Grovant. Washaishash, Duwamish Territory, Seattle, Washington. What I said was, my name is Roxanne White. Well, I said good afternoon. And my name is Roxanne White. I'm Yakima Nez First Nooksack and Ananin Grovant. And I presently reside here on Duwamish Coast Salish Territory, Seattle, Washington. And I am grateful and honored to be here. I want to thank Sovereign Bodies Institute for providing this space. And I want to thank all of you for coming on this webinar. I also want to say that, you know, I'm nervous. I always like to say that right off top, and that I'm grateful to just be able to share as a survivor in this space with all my sisters. Thank you.
And I'm Rachel Smith. I am Chicana, Chiricahua Apache, and Tohono O'odham. I am here on Miwok Nisenan land. It is a pleasure to be with you all. Thank you.
Thanks, ladies. And I just want to reiterate something that Roxanne shared. She shared that she's feeling a little nervous, and I think all of us who are speaking today may feel a little bit of nerves, and all of us are seasoned public speakers, but this is a little different for us. We're all learning to kind of reclaim our voices as survivors and as survivor leaders. And so this is a big first, not just for SBI and for the council, but for all of us individually in reclaiming our voices as survivors. So if there's ever a little pause and someone needs to kind of search for their words for a moment, that may be why. And we really appreciate all of you having patience for that, and you know, being compassionate in understanding that it's difficult for survivors to talk about these issues. So with that, we're gonna give an overview of this webinar. We're gonna talk a little bit about pre-existing patterns of violence for those of you who may not be familiar with what trafficking or sexual exploitation looks like in Indigenous communities, or maybe aren't familiar with the issue of missing and murdered Indigenous women, girls, and Two-Spirit folks. And then after that, we'll dive into the heart of our discussion today, which is COVID-19's impact on those forms of violence. And we'll conclude with a discussion of what we can do as individuals and community members, but also what is needed from policymakers, funders, and other kind of boots on the ground type organizations. And we'll have some time at the end for Q&A. This webinar is 1 hour and 15 minutes long. We've budgeted time for questions within that. If anybody isn't able to stay for the full length of the webinar, we are going to post the recording online. And we're also, we have an open letter that kind of summarizes some of the content of the webinar currently available on SBI's website, which is sovereign-bodies.org. So we're going to talk about pre-existing patterns of violence, and I'm going to turn it over to Jessica.
Thank you, Anita. I think that first it's important to note and for people to understand that trafficking is not something that we initiated. The violence and trafficking of Indigenous women was initiated during Christopher Columbus era. Christopher Columbus was a human trafficker and a murderer. So trafficking is not something that is new. MMIWG is not something that is new. It comes as a result of hundreds of years of colonial violence against Indigenous people. It's also important to note that the stats on the slide here are based on what is reported, and that many more cases go unreported out of fear of retaliation and feelings that survivors may have of being ashamed. The bullet point that I feel is the most important to highlight here is that 27 of the 132 tribal law enforcement agencies reported initiating investigations involving human trafficking from 2014 to 2016, and 6 of the 61 major city law enforcement agencies reported that they initiated human trafficking investigations that involve at least one Native victim during the same time period. I think it's important that those numbers, they seem relatively low. 27 out of 132 agencies initiating investigations. we have to be better than that. All agencies should be taking part in these type of investigations. I know that in Minnesota, there's a task force that's called the Trust Task Force, and it is a statewide task force that is investigating juvenile sex trafficking. And it's important because it's a tribal task force, and it's all of the Minnesota tribes coming together to combat the same issue, and that issue is juvenile trafficking. And I believe that this task force sets a precedent for other tribes to start doing the same thing.
Thank you, Jessica. And we do have some stats here from Sovereign Bodies Institute, our database on missing and murdered Indigenous women, girls, and Two-Spirit people as it intersects with trafficking. And the one here that I really want to draw your attention to is on the bottom right. And that's with regards to trafficking of Indigenous youth who are identified as being in foster care. We're going to talk later on in this webinar about particular needs that Indigenous youth who may be in foster care or are runaways need at this time that they're not getting. So I think it's important to note that 69% of cases where a woman or a girl or Two-Spirit person was killed or went missing while they were in foster care also experienced sexual or domestic violence, and almost half of those victims experienced sex trafficking or sex work. So we are seeing a major intersection, not just between the foster care system and sexual exploitation, but actually cases that lead to our children going missing and being killed. And with that, I'm going to transition into some of our data on MMIWG2. This data comes from our database, which started about 5 years ago. I started it as a community member and as a survivor of violence. I had recently escaped trafficking. My hand was still broken from the abuse. And I got really frustrated with people saying, well, we don't know how many cases there are. We just don't know. And I thought, well, we can sit down and figure it out. And years into that process, we were really fortunate to be able to partner with Seventh Generation Fund for Indigenous Peoples, and they supported us in creating Sovereign Bodies Institute, which is now the official home for the database. The data that you see on the slide here represents data on the US and Canada, although we do have a sister database for our sisters from Latin America as well. So as of now, we have approximately 4,200 cases documented, over half of which are murders. Over half of the cases are from the US, and 54 states and provinces and over 450 tribal nations are represented. And I think that's really important because the media kind of portrays this issue as something that only happens in certain pockets of the country or certain hotspots. And the reality is that this violence happens everywhere. There is no community that is not touched by this issue. So all of us, no matter where we live and what community we're a part of, we do have a stake in this. 27% of the cases are girls ages 18 and under, and 35% are 21 and under. And the reason we wanted to share that is, again, to show that we're not just talking about women, we're not just talking about adults, we are talking about our youth and our children and our young women, and they are disproportionately represented in the data. We've documented 96 cases of law enforcement brutality or negligence that led to death of an Indigenous woman, girl, or Two-Spirit person. And the reason that we're sharing that with you today is to call attention to the fact that all of the issues we're seeing with law enforcement are not anything new, and it's not a matter of one bad apple. It's a systemic problem with law enforcement bias and prejudice that leads to not only cases not getting the investigation they deserve, but really frequent instances of law enforcement complicity. We've also documented 23 trans women and Two-Spirit victims, and the reason we share that is because our trans and Two-Spirit relatives are often misgendered in official data or law enforcement records, and their cases are usually not covered by media. So they don't get the same level of advocacy or visibility. And it was really important to us to make sure that we did our part to try to remedy that today. So hopefully that gives you a better sense of the kind of pre-existing issues prior to COVID. And with that, we're going to dive right into talking about how COVID impacts these patterns of violence. And I'm going to turn it back over to Jessica and Roxanne.
There's a common misconception right now that because of COVID-19, there's not trafficking or there's not domestic violence, that is lessened, and that is completely untrue. Just to state the fact that in Minnesota, the first weekend of the governor's stay-at-home order, 2/3 of all police calls were domestic violence related. So that, and with the other articles here that you can see on the screen, clearly shows that there is a heightened rate of violence due to COVID-19. And I think that it's really important for survivors to know that we believe you and that we are here for you. There are resources available for women who are feeling trapped and who are experiencing abuse by someone in their home. At the end of this presentation, we do have a list of available resources for survivors. And again, just want to emphasize that we believe you and we want to help you.
Thank you, Jessica. Absolutely. I'm going to speak a little bit on community and cultural gatherings. We as Indigenous people are experiencing this shutdown of ceremonies with no access to our sweat lodges, our longhouses, our coastal jams and powwows. Community gatherings as a whole for the whole entire world is not accessible right now, except for the bare essentials. And for us, our bare essentials are our culture and our ceremony. These healing ceremonies are crucial, very critical to our survival as Indigenous people. The great news is, for all of us, is how resilient we all are as a people. What I'm seeing in my own community or in the area or territory I live in is organizations pulling together that are Indigenous led. And I'm seeing a beautiful display of community gathering while social distancing and not actually being together, but sharing our resiliency through our culture on social media right now.
Thanks, Roxanne and Jessica. Sorry, did someone else want to add something real quick?
Well, I was going to say, in regards to the COVID-19 and domestic violence and survivors, just speaking to what Jessica already said, we are experiencing all these things, and there are resources out there, whether they're scarce or not, or we have certain systems that are still showing up. I really feel like we're getting through this as a community, as a nation of many nations, coming together to support our survivors and our victims or people that are struggling in violent situations, unsafe situations. Thank you.
Exactly. And I think something that the council has talked about a lot is this presumption that because people are at home, the violence has decreased. And as Jessica mentioned, it's really clear that domestic violence has actually increased under the shelter-in-place directives. We're also seeing heightened risk factors for trafficking under COVID-19. And I'm going to turn it over to Carrie to talk about some of those risk factors.
Thank you. The intersection of sex trafficking with COVID-19 is creating more on-ramps for traffickers to take advantage of our children. Our children that at this time are home and are dependent on their tech devices to complete schoolwork. Children are unsupervised some of the time, and they're spending more time on gaming and social media sites. The gaming industry generated $43 million in revenue in 2019, and predators utilize those game features and gaming culture to groom online relationships. Technology, including sexting, have many tragic results of children being forced into sex trafficking through threats of harming the children's families.
Thank you, Carrie. That's absolutely true. And I know, speaking for myself personally, I was trafficked by someone I met through online dating. And it certainly didn't happen immediately. It was something that happened 6 months into the relationship. And so I think there's a lot of reason to be cautious about using these spaces right now. And it doesn't mean we don't use them. It just means that we go into it with a little more caution and some better practices about what we share and what we don't. I also want to speak to some of the issues around housing and income insecurity. We know that nationwide we're seeing furloughs, layoffs, and pay cuts, which leads to housing and income insecurity. One of the things that we haven't seen talked about a lot is that any folks who are working in strip bars overnight were out of work. So we're worried that people who may be more desperate are in a position to be sexually exploited or to engage in survival sex work, and that this economic downturn does uniquely impact folks who are already engaged in other forms of survival sex work. We're also concerned about the lack of sexual health items in mutual aid kits and the lack of access to health care that uniquely impacts women and girls and can make unsafe situations more unsafe. So we've seen reports of extreme difficulty in accessing abortions. We're also concerned that mutual aid kits, by and large, don't tend to include contraceptives. Imagine if you're being trafficked or engaged in survival sex work, or even if you're a domestic violence victim, access to contraceptives can be absolutely life-changing, not only because it can prevent a pregnancy you don't want or don't have the resources for, it also can prevent STIs. And so it can be a life-changing, life-saving resource that can keep people out of healthcare facilities who don't need to be there, and to have a little more self-determination about what happens with their bodies. And now we're going to talk about lack of adequate resources for victims, and I'm going to turn it over to Roxanne and Rachel.
Thank you, Anita. So right now, what we're seeing as far as the shelters are concerned for domestic violence and trafficking is they're already impacted and already full, but at this point, it seems like they're not able to take anybody else in. So what we've also seen with this is originally, a lot of the victims and survivors are, they're assigned an advocate that they work with. And for some of the tribes and some of the organizations, the advocates were not looked at as essential workers, and so they were laid off. And so now, because of the rise in domestic violence calls and situations, they have called those advocates back. That is a huge part of healing and emotional connection for a lot of the survivors who are out there. We also see a lot of organizations who will house Indigenous victims and survivors, but they're not culturally competent. And when I say that, I mean they don't necessarily have the knowledge to, I guess, enforce or encourage the other providers to support the traditional and cultural healing, which is a huge part of a lot of survivor healing. We are also seeing, like you mentioned, the healthcare, the access to healthcare for STI, where trafficking survivors are involved or concerned. The lack of access to providers or even getting anything. A lot of healthcare are doing Zoom meetings or telehealth, if you will, to meet with their providers. But if you don't have internet access and you don't have the technology to support that, there's not really a whole lot of that the survivors, they don't really have anywhere else to turn. Another thing is the youth in foster care that are the runaways. At this point in the counties that I support and that I work with, there is no court is not opening and changing orders. So they're doing all of the hearings virtually and online, or through calling, I'm sorry. And so what's happening is when there is an abusive situation in a foster home or even in a group home, the youth don't have anywhere to go to. Should they choose to run away, then at that point, they're not tracked. The tribes are definitely not contacted. And if the tribes are, some of those workers are not considered essential to be receiving those calls on the other end. We also see the youth that are incarcerated right now, for whatever reason, if they're trafficked and they get picked up on a violation of probation, they're sitting in juvenile hall facilities, and they actually don't have access to their lawyers, to regular medical providers, to the advocates, like I said before, because they're not staffed in jail right now or in youth detention centers. And that is a result of the COVID. And so we're seeing a lot more, a bigger issue that is happening that's actually being discussed or addressed at the media level.
Thank you, Jessica. I'd like to add to that. I made some phone calls this morning, and just out of curiosity, since COVID, and I found out that 3 out of 3 domestic violence shelters, 2 which were Indigenous, on reservations, and 1 that was here in downtown Seattle, didn't answer, but the other 2 were closed down right now. And I did get to speak to somebody from the office explaining that due to COVID-19, that they have closed the shelters. So my belief is, you know, and what I'm seeing and what I know, the work that advocates do, and I'm seeing other sister agencies here in Seattle, the advocates and the outreach workers are doing a gist of the work with community. So I can also concur with that. And I'd also like to add, in my personal experience as a survivor off reservation domestic violence shelters and trafficking services, have yet to implement any cultural specific resources that are centered in supporting survivors that are Indigenous. We are suggesting that these organizations do further work to meet the needs of Indigenous survivors. It's so crucial. Our resources are limited. Our stretch for the urban areas. So as we continue to do these things, this is something that we'd be looking for from other organizations, but also as a survivor, just coming from that place, looking at what we're dealing with as a community. We also have the ability within our community and as survivors to hopefully reach out to or have family members, grandmas, you know, different people that we can find support in, and as family members, as community members, to please remember our those that are most vulnerable in our communities. Like, that's super important. Thank you.
Absolutely. Thank you for those really great points. And on a similar note, it's not just advocates who are struggling with incapacity right now. It's also law enforcement and the justice system. So I'm going to give a chance for all of our speakers to chime in on this one.
With the COVID-19 health concerns coming to the forefront of life in the United States, there are resulting in operational changes to the judicial system due to this pandemic. In my area, the victim witness staff has mostly switched to remote work setting, which I would imagine is pretty much everywhere that their staff is working from home. So having to rely on technology is huge. In the St. Louis County courthouse here in Minnesota, They are utilizing all of the web resources for victims, especially for victims who want to participate in court hearings. There has been a remote phone connection being used by court administration that allows victims to hear what is taking place during a hearing. Additionally, access to internet-based video conferencing is being allowed to allow the victim the ability to view and participate in required hearings where the victim has the right to provide input. I'm suggesting that this, if other counties are not implementing procedures like this, that they should be, because just because victims cannot be there physically, it's still very important to address their needs and to cater to their needs throughout court hearings and the thing. Also, in regards to law enforcement response, I believe that it's really important to highlight that just recently in Fairfax County, over 24 men were arrested in a sting that was dubbed Operation COVID Crackdown. This operation was aiming to identify and apprehend sexual predators who use online platforms as means to exploit children. In total, there were 30 men that were arrested and charged with a combined total of 68 felonies. And police say that these men used various platforms on the internet to engage in explicit conversations and attempt to solicit sex from undercover police officers that were posing as children. So just this one county were able to apprehend this many people. I feel like if more counties were to do operations like this, it would make a really big difference in cracking down on the sex trafficking online.
Thank you, Jessica. I would like to speak on the difficulty for filing missing persons reports and the fact that law enforcement is focused on COVID-19. I just want to say that that currently I have had families reach out to me because they were in fact still having difficulties filing a missing persons report. As we all still are working through this jurisdictional barriers through COVID-19, the reality is that we're not seeing the numbers of MMIWG2 decrease in our communities before COVID-19. Our community, our people have had these jurisdictional issues, which has set so many barriers for victims, for families, for law enforcement, for safety and protection. And so through COVID-19, as we were making leeway as advocates and legislators and communities were building towards this space of like being able to change the course, it's back to basically grassroots, and I'm really grateful to be a grassroots person, to be able to provide some type of support for families that are still experiencing several difficulties due to COVID-19 and that we're here. So we're going to continue to do the work, but it's very difficult through COVID-19 for sure.
Thank you so much. This is Carrie, and I'd like to speak to this slide as well. This slide really impacts me that our response right now leaves me with a lot of sorrow and a lot of feelings about the victims and what they're experiencing. And I know the sisters have expressed to me in our different times together how the advocates are kind of being told that during this time they're not essential workers. And, you know, that really gets to the heart of the matter, that that needs to change, that survivors need to be brought forward and be brought to the table with law enforcement and these justice systems to give a proper response during these times. We need to, to be invited in because this is impacting, and we'll have more intergenerational trauma as a result of this COVID-19. Thank you.
Thank you, Carrie. I agree with everything that everybody has said. We all have some pretty good points. I think the only thing I would like to add is within the last, overnight, LA County, they submitted an article in the paper and basically saying that they're seeing an uprise in domestic violence, but there is a low, they're getting any calls for child abuse. And so typically the eyes that are out there on the children, the teachers, the healthcare workers, the janitors, anybody who is out around youth who have the opportunity to report the abuse and neglect, those numbers are going down. So that was brought to our attention today. And in addition to Placer County, which is one of the counties that we support as well up here in Northern California, they are seeing a desperate need for foster parents and placement up here. I guess they are having a lot more calls up here than they did prior. And so finding placement for these youth is pretty much, it's pretty impossible at this point. There's a lot of families that are very concerned about youth who are runaways, who aren't going to stay in placement, who are going to contract the virus and bring it back to their families, which is a valid fear. At the same time, what's happening is our youth are being left out, either homeless, in, drop-in centers, and it's not even officially a drop-in center here in Sacramento County. They're just awaiting placement. So we are seeing a lot of impacts to the youth specifically, especially the ones who are being trafficked and experiencing domestic violence right now.
Thank you, everyone, for those really great points. And, just to add that all of these issues don't just impact people who are experiencing violence in the immediate. There's also an impact on survivors, even from a long while ago. So, for example, we work with MMIW families whose loved one has been missing for 30 years, and there still should be active work done on the case. I've seen tips come in that law enforcement are not responding to at this time, or even for myself personally, I escaped my trafficker 5 years ago, and now he's currently not under Department of Corrections supervision and is able to travel freely, and is harassing me and stalking me for the first time in years. And the court in my county is closed. So I can't file for a protection order. And I think the thing that I really want to stress about that is while my county court is closed, the tribal courts in the area are still open and functioning and providing protection orders to victims. So I think that's a really powerful teaching from our tribal courts, that our people are the ones stepping up, and we are capable of protecting our victims and of providing those critical resources. So if we can do it, then the settler state needs to catch up and start doing it too. We do want to talk about a specific MMIW case today, Kayana Odyssey Gonzalez. We have permission from her mother, Bettina, to talk about her case. We've been working with Bettina for a while now in trying to pursue justice for Odyssey. Odyssey was Northern Cheyenne. She was 21 years old when she was murdered in Billings, Montana in June of 2019. We are coming up on the 1-year anniversary of the case. And even as recently as April 7th, we've been working with Bettina to try to follow up with the prosecutor's office and with police to see what's being done on Odyssey's case and if charges are going to be laid. And the prosecutor's office is closed, so no one's taking any phone calls, and we've sent emails and received no response. So this is a situation where the family is working pretty earnestly with advocates to try to get some answers and to advance the case, and the justice and law enforcement system is just completely unresponsive. To give you a sense of what happened to Odyssey, she was trafficked by a non-native man who was her boyfriend, and he was very physically and emotionally abusive to her, and that abuse was well documented and witnessed by a number of people over a long period of time. And eventually Odyssey escaped and left him, and had kind of rebuilt her life and was working on healing. And one night she was home asleep at her mom's house with her sister, and her trafficker and one of his associates came to the house, of course uninvited, and tried to provoke an altercation that ultimately led to Odyssey being shot in the stomach, and she later died in the hospital. There was a number of witnesses to what happened. They've all provided statements that said that the trafficker's associate was the one who killed Odyssey. There's evidence that that murder was premeditated. The state chief medical examiner has ruled the case a homicide and encouraged the prosecutor's office to press charges. And as of today, there are still no charges laid. So we're concerned that there should be trafficking charges, there should be homicide charges, and she was killed with an unregistered weapon. At the very least, there should be a charge for possession of an unregistered weapon. And none of that has happened. So we've seen a complete lack of justice in Odyssey's case. And I think what's most disturbing about Odyssey's case is the family has been led to believe by law enforcement that the reason that the killer has not been charged is because she says that she was trafficked too. And it's notable that Odyssey's killer is a white woman. And law enforcement are essentially deciding to not hold her accountable for killing Odyssey under the basis that she was being victimized and trafficked. So they're believing this white woman and her story, and aren't giving any weight or credit to any of the evidence or eyewitness accounts that Odyssey was also a victim and was being trafficked too. So there is a racialized double standard where police are serving white victims in a way that they are not serving Indigenous victims. Now we're going to transition to talk about lack of media coverage, and I'm going to turn it over to Jessica and Roxanne.
Yes, thank you, Anita.
So prior to COVID-19, the media was finally starting to take notice to MMIWG cases and highlight the work that advocates and activists and grassroots organizations have been doing for years. In my area, the news outlets had really put on really well done news coverage, multiple special reports on MMIWG. My own personal survivor story was aired on the 6 o'clock news. And then all of a sudden COVID came and that all stopped. Now none of the news are covering anything that's MMIW related. We're not getting any updates on cases that are happening in this area and all across the country. So I think that it's really important to recognize the grassroots organizations, because in the mainstream media, MMIW is on the back burner again, when we had just finally got that highlight in the news, and now we're back on the back burner. So it's important that the grassroots organizations, they haven't stopped covering this issue, and Roxanne will speak on how they're still doing the important work that needs to be done and that needs to be continued to be done.
Thank you, Jessica. And yes, this is one of my, this particular topic means so much to me, media, and it's been the center of grassroots work. So yes, we're certainly, as grassroots, we are and have been on the forefront of MMIWG2 for decades, going back to the late 70s with our First Nations relatives. And fortunately, grassroots organizers and advocates are are extremely resilient. We are continuing to do the work for MMIWG2 families, survivors in our Indigenous communities. Culturally, like when we look back on grassroots as taking boots to the ground, to the streets, going to law enforcement front door steps, to state capitol, to down the middle of the streets, we have definitely done our due diligence to bring forth attention for MMIWG2. And one of the biggest things that I'd like to say even today, that we can still utilize, and we are still utilizing social media as an outlet to get the word out. We have social media Facebook pages and groups that cover and communicate across Turtle Island all the way to our First Nations relatives, Alaska, South America. We're able to stay connected and get those flyers out there. We're still continuing to do the work. We're still continuing to use media. We have many great, besides, mainstream media, we have amazing Indigenous led media like Indian Country Today. We have local Indigenous media here in Washington that covers news that relates to us, that is about us. And I think that through this, even though we don't have mainstream media, that is almost nothing new to us. Although I do want to thank many media that before COVID-19 that I've been able to work with, CNN, Al Jazeera, HuffPost, Seattle Times, New York Times. There have been many that have reached out and have stepped up to, sharing the stories of our MMIWG2. And so for now, that even though things are on hold, I'm very pleased with what we do as a people. Thank you.
Thanks, guys. We're going to move on to our two last slides that are part of this section, and that's impacts on survivor mental health and cultural impacts. So Carrie and Jessica are going to handle impacts on survivor mental health.
Thank you so much. COVID-19 brings feelings of isolation. The traffickers use this isolation to control and increase their power over the victims. The power and control, the isolation, using coercion and threats, emotional violence, physical violence, sexual violence, manipulation, economic dependence. It's all heightened right now with this pandemic. And the fear and the impact of this is creating more feelings of powerlessness for the survivor. This again, these feelings really impacts me on a number of levels that I can speak to, and that is one, being a survivor and remembering those feelings that we're talking about is something that just doesn't go away. It's something that produces what's called complex trauma and has long, lifetime effects. Families as well are experiencing their remembering of their generational trauma and the reminders of being silenced for fear of being murdered and missing. So this time is on so many levels creating additional trauma that we as Indigenous people know so much about. It lives within us, the effects.
Thank you, Carrie. One thing that I would like to note on is when people are saying things on social media, I'm sure everybody's seen it or heard somebody say it, but when people say you're not stuck at home, you're safe at home, that type of message angers me because that is not the case for many people. There are a lot of women and children who are not safe at home. So it is important for people to be empathetic and to think about other people when they're sharing things like that, because just because you may be safe at home doesn't mean that I am or that she is. And those types of things can be really triggering for survivors. When it comes to mental health and being confined at home, that feeling of being stuck is triggering, and people's mental health causes them to suffer more than they already are. And for me personally, this leadership council has done more for me that I didn't even know I needed. Finding people who have gone through some of the same things that I have and who are on the same path to making changes that I am has been more healing to me than anything else I've ever done. So I think that it's important for all survivors to know that there are people out there who are willing to help you, and that you are not alone in this, and that you just need to reach out because we want to be able to help you.
Thanks so much, ladies. Roxanne is going to round this section out by talking about some of the cultural impacts on Indigenous survivors that she mentioned earlier.
Yes, thank you. Yeah, these things that are making it difficult for us at this time is lack of culture, lack of service, lack of ceremony. But our resiliency is shining bright right now through social media. Our people are connecting all across the country and Canada through the social distancing powwow and sharing healing dances and songs. I don't know how many of you have witnessed that on Facebook and in different outlets, but it's really nice to see people come on Facebook and share a jingle dance or fancy dance, coastal jams, and storytelling. So I'm extremely grateful as a survivor for Indigenous led organizations also, that we have here in the Coast Salish territories organizations that are Indigenous led that have sent me through the mail sage, sweetgrass, cedar. I've had Indigenous led organizations deliver food packages, toilet paper, face masks, gloves, and hand sanitizer. And so, you know, we do have a lot of people that are out here doing things through agencies, through outreach, and through networking in our community. But they're not just taking care of survivors, they're taking care of our elders and our children and our families. And so when I think about like all of the stuff that this is impacting through our resiliency, you can see all around us that people are trying to find the best possible way to continue to share positive energy with each other.
Thanks, Roxanne.
Thank you.
We're going to go straight into our section on what we can do and what's needed. And I want to be conscious of time and make sure we leave time for questions. So we're going to get through this section real fast, but please know, again, this is going to be on our website. And we also make some of these recommendations in our open letter that's already available on our website. So we're going to talk a little bit about what we can do as individuals and community members. Does anyone want to chime in here?
I think just the most important thing, especially for me as a parent, is to be monitoring and informing my daughter about the dangers of online predators. My daughter is super into TikTok and Snapchat and all of those platforms. So for me as a parent, it's important to tell her about the dangers that, you know, she wouldn't really know about if I weren't to tell her. there are people posing for, you know, just in all the men that were arrested in the COVID crackdown, you know, some of them were posing as 13-year-old boys and trying to solicit sex from these girls. So it's important for our youth to be knowledgeable of the dangers of online activity.
I would just like to say that as a survivor, things that have impacted my healing are, you know, really these types of opportunities when I can come together and take action, social action around education, helping people to understand and identify. And, you know, it's so important, the survivor services and the support of the community, the coalitions, and law enforcement to invite us to the table where we can participate. Thank you.
I would like to hold policymakers in the justice system and law enforcement accountable, and really emphasize this, because this is an issue that, again, has been in our communities since 1492, and it doesn't seem to be slowing down anytime sooner. And I think, you know, doing this work in direct services for the Native community for about 5 years now, what I'm seeing has been happening since the beginning of time. And if we don't start asking each other and being more accountable as to why the bodies of Black and brown children are not as valuable as their white peers, we're always going to run into this situation. We're always going to run into these, you know, missing and murdered Indigenous women's stories. So policymakers in the justice system and even law enforcement have to be aware of the racial impacts and the biases that are constantly out there. Many people don't like to look at it. They don't like to discuss the issue of race, but it's real. And we know that it's real because there aren't studies of missing and murdered white women out there.
Thank you, Rachel. My only add to this is I'd like to talk about Indigenous-led. I would like to call out to see more Indigenous-led organizations to implement more awareness for safety practices online. As a survivor, I think I'd like to answer to the call to collaborate with agencies to heighten survivor voices into these programs for the benefit of my people. Coming into this space with Sovereign Bodies Institute, also I echo what Jessica said. I feel safe in this space, and I feel empowered in this space, and it feels good to be doing this work with other survivor sisters. All of us are, like Anita said in the beginning, we're not professionals. Some of us are nervous, some of us have done work, but it just feels good. And so being able to move forward and work with other agencies as an Indigenous survivor, that would be something that I would love to be a part of and love to see happen for each and every one of us. Thank you.
Thanks so much. And I'm just going to breeze through the next couple of slides really quick so that we have a couple minutes for questions. We wanted to summarize some points of, you know, when you are going to your policymakers, or if you work with funders, or if you're going to organizations in your area, these are some things to ask for. So additional supports, including financial support and cultural training and programming for trafficking shelters and to tribal communities trying to build them. Harm reduction policies and resources for folks engaged in survival sex work during the pandemic. A concrete funded plan to enhance law enforcement and justice system capacity. Immediate plan to address safety of runaway and exploited youth. and consistent, respectful media coverage and additional culturally relevant resources and programming for Indigenous survivors. I'll just share, SBI has been doing virtual art therapy circles. We've been doing songwriting, we have beading coming up, and those are in really high demand. Our beading circle has a wait list of over 75 people. So we really urge other organizations that are trying to think about what they can do virtually or what they can do in a safe way. Think about putting together some art kits and mailing them out to the survivors you work with. It makes a big difference, and it can help them feel more comfortable coming to you, asking for more direct services individually. And I want to echo Roxanne here. Survivor expertise matters. We know what the needs are and how to meet them because there are needs too. And I think this webinar proves it. We understand the shortfalls of the system and what survivors need. And you can see that throughout this webinar, but really throughout all of the work that the council takes on and that SBI is taking on. And that's our mission as an organization, is to create a platform for the survivor expertise because there's so many valuable contributions that survivors can make. We want to close out the webinar by offering some resources. These are some helpful hotlines for any of you who may feel they need it, or if you have friends or family members or clients who need it. I also just want to share SBI. We've got a support line available, virtual support circles that meet 3 times a week, the virtual art therapy circles. We're doing virtual vigils for families of missing and murdered women. And we provide limited direct services to MMIWG2 families. So if you know anybody who may be interested in any of that, please reach out to us. And with that, I think we have a few minutes left for some questions. Which of our speakers is able to field some questions for us?
Before my internet connection kind of jerked out here, but before my internet went down, I was able to pull some of the questions that were already asked. And let me scroll back here to find one that was important. Where is it? Oh, sorry. Oh, this question comes from Jolene Holgate, and she's wondering about the resource shortfall of PPE for victim advocates and survivors in the shelters. Are there any resources available for VA client PPEs?
That's a great question. And I think it's something that's missing from the national dialogue on PPE shortfalls. The only thing that I can contribute by way of an answer is to say that we know volunteer community members who are working hard to try to create face masks. I know that there's an Indigenous woman in the Seattle area who's also making face shields for healthcare workers and advocates. So there are folks in the community who are stepping up to create those. We have a couple references for people who are doing that. So certainly if there's any advocates on the call who need that for their organization, if they're providing direct services and open to survivors right now, shoot us an email and we'll try to connect you with somebody who is working on creating those.
Okay, and another point that I'd like to highlight here is from Valerie Abia. She had said that she works in a juvenile hall in the Bay Area, and they have a lot of CSEC, but there are no resources for youth, let alone culturally appropriate ones. We have staff that are totally disconnected from our youth and can never identify with them. And just from my opinion, as a survivor, Valerie, I would suggest maybe seeking out, other survivors. The need for agencies to hire survivors is so great because of the expertise that we have, and they are our needs, so we know how to meet them. So yeah, I would just emphasize on hiring survivors.
I can speak to that as well. Valerie, she's talking about CSEC youth, which is commercially sexually exploited children, which is sex trafficking. And so in the Bay Area, there are resources, SCUI, the California Consortium of Urban Indian Health. There's also a cultural center down there. The Friendship House and the Native American Health Centers can actually get you connected to possibly, ideally, advocates that can come and work with those youth. There's also the Red Women Rising website that you can access and just look yourself if you want online, and they will follow up and send you, typically I think they respond with an email. There's access to traditional healers on that website as well. And so if you want to send us some information, I can definitely connect you with local resources in the Bay Area.
Thank you. Are you guys done with that one?
Yes.
Okay, I'd like to respond to Francine Joe. And she asked the question about in Canada, we just finished MMIWG National Inquiry last June. I heard USA launched MMIWG Task Force in the United States, and she's wondering what the status is. Thank you, Francine. The last thing before the pandemic broke out, from what I understood, like they were going to be making trips around different tribes here in Washington to do like listening sessions, and I witnessed those listening sessions happen in Canada, and that is all on hold right now. I think it's fairly, MMIWG2 is not new, but I think over here, like a lot of people are still trying to figure out what it is here. So my answer to that is, I think everything is on hold. We were starting to make a lot of leeway, and I think we'll continue to do that when this comes out, because the whole government is focused in on COVID-19 right now. And that being said, there's another one on MMIWG, which is what is happening to the cases of Indigenous women murdered throughout the U.S. Anita, do you have anything to say to that one?
Yeah, I mean, the short answer is nothing. Unfortunately.
Exactly.
I mean, so SBI, we work with, we provide direct services to about 60 families across the country. And I know that some of the ladies who are speaking today also work with additional families. Roxanne has a lot of experience doing that. And the experience that I have heard from every family we work with that's trying to get in contact with the system right now, and certainly our experience at SBI has been that nobody in law enforcement or the justice system is available. There are no updates provided. There are families that even, used to have good relationships with the detectives on their loved one's case and would have like weekly check-in calls with the detective. And those calls have ended with no notice or warning. And they're not answering messages. So
I concur with that.
Yeah. So at this point, nothing is happening.
Yeah.
Well, I think we might be almost out of time. Maybe we have time for one more question.
There's one down here from UN Special Raptor. I can't even, reporter. Very bottom. By Francine Joe again.
Just read it, because I think that might have happened when my connection went out, Roxanne.
Oh, it says UN Special Reporter on VAW is requesting submissions until June 30th on how COVID has affected VAW. Will you be providing a submission?
Yes, SBI already has.
Awesome.
Awesome.
Somebody's asking if we can show the contact info again. I think it was one of the last slides, Nita.
Right here.
I think so.
And just to stress, SBI's support line, we're open 9 a.m. to 3 p.m. Pacific time, Monday through Saturday. But to be honest with you, I have it like logged in on the app on my phone and I forget to log off. So there's a good chance that I'll probably pick up if you call outside those hours too. And in any case, we can get your voicemail, or we can also receive texts at that phone number. And we do follow up with every single call or text we get.
Someone's also asking if this course is going to be eligible for CEUs.
No, we don't have that set up at this time.
I think this one's important, you guys. It says, I'm curious if you have any resources specifically for survival sex workers. That's a great, I mean, that's a question that I would have. That's the kind of question that I think we should address, as like going into like the end, how we had services that we posted up that would be available. I myself, in the work that I do, don't have specific services for sex workers.
What type of services are they looking for?
Curious, just any resources specifically for survival sex workers.
So that's a complex question, because a lot of the survival sex workers, sometimes they need help with drug and alcohol use. Sometimes they need help with medically medical assisted like treatment. So there's that part. There's also the housing issue. That's a loaded question. So something more specific, and then the region that you're in, we could probably look more into that, but we would need a little bit more information.
Yeah, here in King County, there are some programs. They're not Indigenous centered or Indigenous led, but there are, and maybe I'm wrong. I may have not heard of one, but I know of a program here that I actually utilize by the name of OPS. And OPS provided me some great support when I was first exiting the life, and I moved here to Seattle, and it's a great program. They didn't have like housing or anything available for me, but they definitely provided a safe space for me to go like 3 or 4 times a week.
Yeah, so drop-in centers are ideal. In Sacramento, we have a organization here called CASH. It's a nonprofit, and what they do is they have a brilliant program. It's with survivors, run by survivor-led, and the women who want help, many of them are, like I said, they have drug and alcohol use disorder, and so they actually have a bed available. They have an MOU with a drug and alcohol rehab in the area. So what happens is, should the survivor need those services, they go to the drug and alcohol rehab first, and then they come back to the program. They live in a house and eventually go into transitional housing, but there's also a place where they can stop and get the stuff and the supplies that they need as well. But that's here in California.
And I do want to reiterate that the SBI support line, and this is a practice that we had when our office was open and now we're closed due to COVID and working from home, but the support line is designed for questions like this. So if we were to have somebody who's doing survival sex work call into the support line and ask for resources, we may not have it immediately on hand, but we are able to do the footwork to find the resources for them and make those referrals and connections. So to give you an example, we had a woman contact us who is unsheltered and was doing survival sex work, and is also has severe vision impairment, and was sexually assaulted while in her tent, and wasn't ready to like move into transitional housing, didn't really want to stop doing survival sex work because she was comfortable with where she was at, but she came to us for help in dealing with the rape and in finding temporary transitional housing that provided her a space to stay for a couple weeks while she physically and emotionally kind of recovered as best she could from the assault, so that she got a break before she went back to the life that she wanted to live at the time. So we're judgment-free zone about that kind of thing. We really don't even ask, like, what is your long-term plan? Our only question is, what do you need? What would you like? And how can we help get you to it?
Anita, there's one more question here. I don't know who wants to take it, but I was going to ask for people who are doing active street-based sex work or indoor sex work who are just having trouble getting access to resources, whether that be condoms or medical care, because everything is closed.
I mean, it's a challenge, and that's why in this webinar and in our statement, we've repeatedly said mutual aid kits absolutely have to make things like condoms available. I would say tampons and pads too. They're expensive, they're embarrassing to ask for, but they make a world of difference in somebody's day-to-day life and in their health. So I think it's on the folks doing mutual aid to kind of step up and provide those things. In terms of the more specialized healthcare, like things like access to abortion, I know that there is currently a fund set up to cover costs of abortion, including travel to a clinic. And that fund is still operational right now. I know that there's some organizations that were working on creating a map of clinics that are currently open and available to provide abortions. But unfortunately, they're far and few between and can be hundreds of miles away from a tribal community. So I wish I had a better answer, but that's kind of what I know of so far. Does anybody else want to chime in on that?
So again, I'm in California, in Sacramento, and we have a provider here, Dr. Chambers. And what he does is he has a trauma-informed clinic, and all of his residents are trained and trauma-informed as well. And they are specializing in working with victims of sex trafficking or sex workers, for survival sex. And so what happens is a lot of these women will come in and they don't have access to healthcare or medical insurance or anything. And what he has been able to do is write off those appointments. And he basically does everything that he possibly can in order for that woman to be able to leave or get healthcare. Definitely has access to condoms, and even sometimes they're able to, send Ubers and stuff, but I'm not sure. I know that he has trained residents all over the United States. There's also a clinic up in Shasta Lake, and I want to say it's through Mercy Healthcare or Dignity Healthcare, Mercy Healthcare Systems. And so if you want to send us your location or region, we can look into that as well.
I want to be conscious of time. I know we're over time. And maybe, I don't know if speakers want to stay on to address, we still have a lot of people on the call. So if there's any questions left that people want to take on, we can leave space for that. But I do want to note that we're officially over time.
Okay.
A lot of people are asking where they can find your contact info. And I'm guessing that another person had asked if the survivor, or no, I said that, if there's a list of speaker contact info on the website. And I did say that the Survivor Council will have bios on the website. I'm not sure if contact information will be included in that. But in the chat here, I did put my email. So if anybody else feels comfortable putting their email, I would say go ahead and do that.
So we have our website here, sovereign-bodies.org. That has our contact information, like our emails for myself and for our main email. We don't have contact information for all of the members of the council online because we don't have their bios up yet, and we also want to provide council members the opportunity to maintain their anonymity if they'd like to. I think if folks are interested in talking to the council about potential speaking engagements, the best thing to do would be to email me. My email is on our website, but I'll share it here as well. It's Anita with 2 N's, so ANNITA at sovereign-bodies.org. And maybe with that, we'll go ahead and close this out. Thank you so much for sticking with us on a longer than anticipated call. Thank you for joining our first webinar. We're really thankful for the support for Survivor Voices, and we hope that the information we've shared is useful and that there's teachings in here that you can take back to your community to better support victims and survivors. Thank you all.
Thank you.
Thank you all.
Thank you, Kwesiayo.